as spring approaches, many people want to get ready for outdoor activities. For some people, that means getting their arms and legs working again through a joint replacement. Joining us this morning to talk about joint replacements is Dr. Owen O'Neill with the Twin Cities Orthopedics. So it's a common thing this time of year. It sounds like a big deal to me, but you're saying recovery isn't that bad.
Well, good morning, Joy. Yes, joint replacement is very common this time of year because patients, particularly in Minnesota, want to get ready for the summer months and the more active months in summer. And so the joint replacement, which has turned out to be the most successful operation in all of medicine for restoring function and an ability for patients to walk and be active and play tennis and golf and swim, is something that they want to do this time of year to get ready for the summer.
Sure. Okay, so what do we have right here?
So what I have here is some examples of joint replacements, and the important thing about joint replacement is a discussion with your surgeon in terms of what the best type of joint replacement technology and technique is.
Okay.
This is an example of a knee where a patient only has one part of the knee is worn out.
I
so
see.
only one part of the knee is worn out, so we only replace the one part of the knee. That's called a partial knee replacement.
Okay.
This here is an example of what's called a full knee replacement. And what happens is both parts of the knee are worn out. It's bone on bone. And so what we do is we mill or we shape the end of the bone to accept a new part, and then a lower part goes in as well. And then instead of bone on bone, which is very painful, it becomes metal on plastic and it moves like a hinge like that.
Oh, that's interesting.
And then the third is what's called a hip replacement. And the hip replacement is an example of, again, the patient has bone on bone in the joint, and what we do is we put a new socket in, and that socket fits in there, and then we put a new ball in, and then the hip moves like this. It's a new socket that moves in like this.
And you said in a lot of cases people can get up and walk the following day.
Yes, we have patients in the hospital. They walk on their hip or their knee the day after surgery. They use crutches for a short period of time, and then they go to a cane, and then they get rid of any external support within a couple weeks, really.
Okay, well, very good. Thanks so much for educating us, Dr. O'Neill. If you want to learn more about joint replacements, whether you're eligible, whether you should consider it, we've set up a link to the Twin Cities Orthopedics website on our website. Just go to our links page at KSTP.com. Now to an idea.